Today, more than 400,000 people in the United States are living with multiple sclerosis, or MS. Though we don't understand exactly where MS comes from, scientists have made great progress in understanding how the disease works. In this video, we'll look at what MS is, how it's treated, and what resources are available to those diagnosed with the disease and their caregivers. MS is a chronic inflammatory disease that affects the central nervous system. The disease destroys the cells that are responsible for creating and maintaining a fatty layer in the brain and spinal cord, known as the myelin sheath, which helps neurons carry electrical signals.
Myelin is a material that covers nerves like insulation around wires in the house. The overactive white blood cells basically attack the myelin and break it down. So it's the same thing as if in a house the telephone wires are crossed, or the main power wires lose their insulation and they short circuit. So the messages that travel from the brain to the spinal cord basically either travel slower or don't travel at all.
This breakdown in cell communication is responsible for the many symptoms of MS, which vary greatly from patient to patient.
When I was diagnosed with MS, my life changed drastically. When I wake up in the morning, I usually have a lot of stiffness. Usually, it's kind of like having your feet fall asleep or your hands fall asleep. There's also slurred speech, blurred vision, stiffness of joints, and muscle spasticity, which I have quite a bit of from time to time, and numbness in my hands and my feet, coordination, and with balance, and cognitive thinking problems.
Multiple sclerosis can affect any part of the brain and the spinal cord. So you can imagine that any aspect of a person's neurological functions can be affected. Everything from vision loss to double vision, to cognitive decline, to seizures, to motor weakness, tremor, stiffness of muscles, abnormal sensations, pain, abnormal urination or incontinence.
Because MS takes such a different course for different patients, it is easily confused with other illnesses and can be very difficult for a doctor to diagnose.
For example, a patient may present with a little numbness in a leg, and it'll go away, and they sort of ignore it. Or they go to the doctor and the doctor says, oh, it's probably a pinched nerve. So sometimes the early diagnosis or the early symptoms are explained away by more common things.
Once diagnosed, however, there are also a number of different courses that MS may take in any patient. The majority of MS patients suffer from relapsing-remitting MS, where the patient has unpredictable attacks followed by long periods of relative quiet. These patients may go on like that for many years, or they may develop secondary progressive MS, when those patients begin to have neurologic decline between their attacks without any definite periods of relief. MS patients may also develop the more rare course of progressive relapsing MS, where the patient declines steadily while still experiencing periods of attack.
The fourth main type of multiple sclerosis is primary progressive. And at the very beginning, the person has simply a steady decline of neurologic function or a steady accumulation of disability. So instead of having an attack of neurologic symptoms and resolution or healing, there's just a steady decline.
It's not like you have a cold and you know you're going to get the sniffles and a cough. MS is very unpredictable. It strikes everyone differently. And because of that, you just don't know how you're going to progress with the disease. And I think that is probably the most difficult struggle that these individuals have, is the uncertainty of how it's going to progress in their lives.
Whatever course MS may take in a patient, there are a number of treatments available, and doctors are working every day to find new and better ways to treat this disease. At this time, doctors follow 3 different courses of action: treating the MS attack, which is done with steroids, treating the disease itself through immune therapy, and finally, treating the symptoms of MS.
Some patients may have stiff muscles. We can give that person medications that are muscle relaxants to reduce the stiffness in the muscles. Some patients have pain, we can treat the pain. Others may have depression, we can treat the depression. So there's treating the acute attack, there's treating the disease, and then there's treating the symptoms.
Right now, there is no cure for this chronic illness, but research in MS is progressing at a remarkable rate. There are more potential therapies being studied now than at any other point in history. There is also an extensive support network in place for people diagnosed with MS, spearheaded by the National MS Society, which helps patients understand and manage their illness. The Society conducts fundraising events which help provide programs and support services and more.
The ultimate goal with the events like this is to raise money towards research and advocacy and programs so that we can have a future free of MS.
For more information on MS or to contact the National MS Society, visit nationalmssociety.org.
Finding a cure for MS is improving almost every day. There's constantly research being done, money being raised, and new treatments being tested. So I am very confident that they are going to find a cure or something that will drastically improve those that are diagnosed with MS.